They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. Today, we're shining a spotlight on them and their lives. And in our Frontline Diary segment today, we connect with Dr. Sylvain Boet, who is an anesthesiologist and researcher at the Ottawa Hospital. Good morning. Dr. Boet is here to join us now. How are you?
Good morning. Thank you for having me. I'm great. Thank you.
Tell us a little bit about how your work has changed since the pandemic started.
Yeah, well, a lot of changes happened in a very short amount of time. I'm an anesthesiologist and hyperbaric medicine physician, and our department has quickly reorganized itself to take advantage of everyone's skills in the best possible way. So it means that everyone is a clinician, but we have people who have extra skills for administration, leadership, education, or research. And so my job specifically was fully dedicated to research and make care for the patient safer in anesthesiology and also in hyperbaric medicine.
Tell us a little bit more about that research. First of all, you're looking into two primary areas, as you mentioned, PPE research. What are you looking for?
So our research program before the pandemic was on improving practice in the operating room. So we wanted to find ways to make practice of healthcare professionals safer for the patients. And so doing so, we had expertise in providing feedback to healthcare professionals and also using video techniques to assess performance and practices. And so when the pandemic occurred, we put these skills together and pivoted our research program so that we can offer the service of video assessment feedback for our colleagues and use the PPE in the safest possible way.
So your work was almost paving the way for what would come, having to look into this element of your research.
Well, sort of. We actually use this technique in our everyday life to improve practices, and we just pivoted that and use the lens of COVID to actually use these skills and this expertise and make it useful during the pandemic.
You're also researching hyperbaric medicine and the impact on patients with COVID-19. Tell us about that.
Yeah, so hyperbaric medicine is a field where basically the patient breathes oxygen under pressure. So the patients enter a sort of tube, a chamber, what we call a hyperbaric chamber. And that chamber is full of oxygen, and it's a higher pressure that we would normally breathe when we are outside the tube. So it's a little bit like diving, if you wish. And what's interesting about hyperbaric medicine is that there are a lot of ways why it could be very helpful for patients who have COVID. It basically brings up the level of oxygen in your blood by 10 times what people normally breathe. So for people who are admitted to hospital with a lack of oxygen, breathing oxygen under pressure can quickly correct the lack of oxygen. And then the very interesting point with hyperbaric oxygen is that when we have a lot of oxygen in our blood, there is a complex physiological cascade of events that, as a result, is anti-inflammatory.
Wow!
And you have heard of the cytokine storm, right? That killed, unfortunately, a lot of patients. And so we have good reasons to think that hyperbaric treatment could actually fight that storm.
Do you anticipate then that this is the kind of research you will be doing for quite some time?
Well, it depends on the evolution of the pandemic, and right now nobody really knows where all this will go. But we are definitely putting in place a study to evaluate the effectiveness of hyperbaric oxygen therapy on a COVID patient. And so we are ready to start the study as soon as we get the approval.
Dr. Sylvain Boet, thank you so much for all the work you're doing at the Ottawa Hospital, for your research and your time. We appreciate it.
Thank you so much.